Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us once again. Our guest is Dr. Jens Hillengass of Roswell Park Comprehensive Cancer Center, and he's joining us here on the program this morning to talk about a newly FDA-approved immunotherapy combination called Empliciti, and it's going to be used to treat certain patients with multiple myeloma who've received at least 2 prior therapies. Welcome to the program, Dr. Hillengass. Thank you for taking the time.
Thank you very much for having me, Neil.
Well, a bit of background about yourself, beyond being there at Comprehensive Cancer Center.
Yeah, as you might hear, I'm originally from Germany. I was trained in Heidelberg, at the University of Heidelberg in Germany, and worked there in the myeloma section and was the deputy head before I left. And it's the biggest section for myeloma treatment in Europe, so I have had a lot of exposure to multiple myeloma and the precursor diseases, and so have treated a lot of patients, have taken part in a lot of clinical trials, and have also established my own research in myeloma.
Well, this year alone, there are approximately 32,000 people in the United States who are going to be diagnosed with this disease. It's a type of cancer. Talk about this type of cancer. What is multiple myeloma?
Yeah, that's correct. The number is actually correct, and we see that the myeloma patients are usually diagnosed because of pain, because myeloma causes an overactivation of bone-eating cells. Those cells are healthy, but the myeloma, the cancerous myeloma plasma cells, they cause an overactivation, which causes then punched-out holes in the bone, so-called osteolytic lesions. And this is one major effect that leads to fractures, to pain, which then leads the patient to go to their doctor. Another major symptom is kidney dysfunction, renal insufficiency, because of the production of useless, basically monoclonal antibodies by those myeloma cells that can cause function or defects of function of the kidneys. And the third one is a lowering of blood counts. The CBC is different. They have anemia, they have leukopenia because of the replacement of the bone marrow with those malignant cells.
So is that what sets these 32,000 people apart? What puts a person at risk?
Yeah, it's very difficult to say. There's only statistical analysis, retrospective analysis. That's not a clear reason for myeloma. We still don't know that. There are hints that there are some exposures to toxic stuff. Just recently there was a publication that the firefighters of 9/11, for example, had a higher or have higher risk to develop myeloma. So we think that some toxic influences might be a reason for it. But at the moment it's not really clear where myeloma is coming from.
Well, we're here to talk about, of course, multiple myeloma, but also about some breakthrough treatment. Yeah. I understand that there's a recently FDA-approved treatment for this disease. What is this treatment, and who's manufacturing it?
Yeah, so it's manufactured by Bristol Myers Squibb, and I have to mention that I have been a consultant for this company, and also our institute gets research funding from them, so that's to be honest on that. And the Empliciti is an antibody against SLAMF7, which engages the immune system, NK cells, for example, to attack myeloma cells, and it works best in combination with so-called immunomodulatory drugs and in combination with steroids. And there has been a clinical trial showing that this combination of Empliciti, Pomalyst, and IMiD and dexamethasone is superior to Pomalyst and dexamethasone alone.
So is this something that can be used initially, or does a person have to wait until they show certain results with certain other treatments first? Yeah,
exactly. It's approved for later lines of treatment when patients have already been exposed to IMiDs, immunomodulatory drugs, and proteasome inhibitors, to very standard treatment for the first line. And if they relapse later on, if they're relapse refractory, then they can get the Elo-Pom-Dex combination.
In the past, what was the go-to treatment for multiple myeloma other than what you talked about? Were those 2 drugs the 2 treatments ever used in combination with each other?
They were not combined with each other. The Pomalyst and the dexamethasone alone was a standard treatment, or is still a standard treatment, but we have learned that in most of the studies, the triplets, meaning 3 different drugs, worked better than 2 drugs when it was compared to each other, and the same was true in this trial. So the Empliciti, the Pomalyst, and the dexamethasone were superior to the doublet Pomalyst and dexamethasone alone.
What about the advancement, the degree of the disease? Are there different levels of this combination used based on the advancement of a person's myeloma?
Usually, since it's, of course, as every treatment, it has side effects, but usually it's compared to a lot of other treatments, it's very well tolerated. So adjustment of dose is not very common in this combination. If we adjust dose, it's usually the Pomalyst where we can lower the dose if patients have comorbidities, if they are elderly, if they have a lower performance status, that can cause a dose reduction. But often, most of the patients really tolerate this treatment very well.
And as far as feedbacks from some of the researchers that are involved, who are going to be introducing this into the mainstream, are there any drawbacks, any safety risks other than the regular side effects associated with it?
Not that much, since it's an immune therapeutic drug, as we discussed. It's an antibody. There are a few infusion-related reactions. It's less than in some other antibodies, but it's still there. There's a signal, and the major side effects, as you already mentioned, is that they have lower blood counts, neutropenia, more susceptibility to infections. Those are the major points. But this is what we see in basically nearly all myeloma treatments. So this is something that we are very used to and that we can deal with.
Where can our listeners go online and get some more information about Empliciti and about your practice there at the Roswell Park Comprehensive Cancer Center as well?
Yeah, so I use this, of course, to mention roswellpark.org, where we have some information on treatment options, on diagnostics. But of course, the National Cancer Institute, cancer.gov, and cancer.org from the American Cancer Society are very good resources. And specifically for Empliciti, it's empliciti.com by Bristol Myers Squibb, which gives you much more detailed information about the trial and about the approval of Empliciti, pomalidomide, and dexamethasone.
Dr. Hillengass, thank you so much for joining us on the program today. I'm hoping we'll have another conversation in the future.
That would be very nice. Thank you very much for having me.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster, providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.